Amendment 3 is, Amendment 3 is basically, to me, it shows that the state legislature doesn't have any faith in the constituents. The big arguments they have is that either we don't know what we voted for, or that it wasn't properly vetted by the state legislature. But none of the candidates were vetted by the state legislature before the voters voted on them. So it's kind of disingenuous to me to say that it needed to be vetted by the state legislature before. We can't trust the voters to vote on this issue, but we can trust them to vote for us. And the second thing is that you see in the ballot language, it got contested twice in court. And both times the state of Missouri lost because they were trying to trick voters into not realizing that they were changing the voter-approved redrawing of districts from a nonpartisan demographer whose job is to make fair and balanced districts, take into account stuff as community and everything. That's what they do. That's what demographics is. And do it by a partisan board, selected by the governor. And they tell you that the auditor selects a demographer, but she selects three candidates, and that is approved then by another board. So to say that Nicole Galloway is just choosing a demographer that will draw maps to suit Democrats is disingenuous as well. Their whole campaign is based on disingenuous arguments or just insulting the voter. We don't know what we were voting for. Over 60% of Missourians voted that we wanted fairer maps, we wanted fairer elections. And to say that we just wanted one thing is completely false. First of all, Medicaid expansion was an extremely personal issue to me. I lost my younger brother in March of last year because he couldn't afford anti-seizure medication that would have been able to afford if Medicaid would have been expanded earlier. In my district, it's going to affect a lot. I'm Jeff City. You hear the phrase kind of more in like Detroit and stuff like that, but Jeff City is a company town. Our company is the state of Missouri. It is overwhelmingly my largest employer in my district. And Medicaid expansion can do a couple things. Number one, it is proven to lower health care costs, which will help people in Missouri. But more importantly, in every single state that has expanded Medicaid has seen an increase in revenue in their state budget. Recently, Maine, who expanded it, saw an increase about over $200 million in a budget as a budget surplus in 1 year. So in my district, this is a step. We have to recover from COVID, and I believe Missourians took that first step in August by expanding Medicaid and bringing that over $1 billion of Missouri taxpayer money that is sitting outside of our state, according to this Washington University. But not only that, by lowering healthcare costs, by allowing people to be healthy and go to the doctor when it's not a medical necessity, be able to doctor when they're slightly sick, increases worker productivity, and will be able and increases local revenue, helps local businesses because people have more money to spend if they're not worried about catastrophic medical loss. Previously, Dave Griffith, my opponent, said that he supported health savings accounts, called them rainy day funds, but it's hard to plan for a rainy day when being sick and being in poverty is like living in the eye of a storm. State worker pay, we are the worst state in the nation in state worker pay. We are 50 out of 50. Expanding Medicaid can be the first step in increasing our state budget, helping those shortfalls, and make it where the state budget raise is not the first thing the governor strikes through when he has to try to balance the budget. I mean, it's poor. I've said before that the challenges that we're facing from COVID-19 are symptoms of an already broken system, not the causes. And we're seeing that more now with outbreaks in rural areas that typically don't have hospitals to serve. And to go back to the previous question, without Medicaid, because we didn't expand Medicaid, so we didn't have those funds that we need. We're seeing that the governor refused to wear a mask when he was in public, and him and his wife both contracted COVID. And my prayers and thoughts go out to them. I want them to 100% to be safe. I just want all of Missourians to be safe. But the numbers speak for themselves. In my district, There was a Jefferson Manor. There was a nursing home with a little bit over 60 patients, and 57 of them, I believe, contracted COVID. And these are people that are in the at-risk age, people that have potentially could have underlying issues that will just that will hurt them when they're trying to recover from COVID. There is almost 2,000 dead in Missouri, and it's because we didn't react fast enough. We didn't require masks when we needed to, and when we shut down, it was a little bit too little too late, unfortunately, and we opened up too quickly. So we're seeing those repercussions right now. Missouri is one of the top states in COVID infection rate, and Cole County and Jefferson City has a high percentage rate, is one of the top, I believe, in the top 5 of the state. So we're just seeing that they're not taking this seriously. They haven't taken it seriously, and we're dealing with the repercussions. And I'm not sure if they're listening to, not to go through it, but listen to President Trump, where he kind of downplayed it, and they kind of want to downplay it too. But you can't downplay a pandemic. We have to take this seriously, because it's taking it seriously and protecting yourself and protecting your family and protecting your communities saves lives. Well, previously in 2008 to 2019, the Democratic caucus asked for a special session on violent crime previously, and he refused. This time it was, I don't even know if Governor Parson really cared to pass certain parts of the agenda. I think it was more of a distraction to change the news cycle from his complete mishandling of the COVID-19 pandemic. The ideas that they're presenting have been proven not to work. Over-policing in districts do not work. Recently in Jefferson City, I think a little bit over a week ago, there was a shooting at a park. 2 people were injured in the shooting. 2 people were injured trying to run away. This is not just a problem they try to paint this as a St. Louis and Kansas City issue, and it's not. This affects every single community in some way. I would welcome an honest attempt to stop violence in our streets. And that's focused on programs that have proven to be effective, such as helping people transition out of penitentiaries with job assistance, which has proven to stop escalation and recidivism much more effectively than over-policing has stopped crime. And the other thing I would do is try to stop fostering an us versus them mentality between the cities and the rural areas. You talk to multiple people, and they'll tell you, oh, you don't want to go to this part of the city. And that's even in Jefferson City. And it's just, they have this fear, and it's based on, in my opinion, on prejudicial statements that are presented by the governor. You can't trust her. You can't trust people. You can't trust certain. And that just breeds contempt. It's a self-fulfilling prophecy in some ways, where if you tell somebody that all they can do is one thing, that's all they know how to do. We don't reach out and try to build those community bridges into our cities, from our rural areas, and try to get solutions that cross economic and racial divides in our state that will help us actually stop crime. I think the second thing is that we have to have nationwide background checks. It is terrible to me that somebody can commit a crime here in Missouri and go to almost any of our 8 bordering states and purchase a gun and then bring it back here to do harm. That is an issue, and that needs to be addressed. The Jefferson City News Tribune, our local newspaper, recently did an editorial about about the same issue. And one of the things were stopping guns from getting into the hands of people that want to do harm through nationwide background checks.